Welcome. I'm Kathryn Cashman, and I am owner of Cashman Center and a psychologist for many years in the South Metro area. And it's so good to have all of you here. I'm just going to make a few opening remarks before we get started. I want to thank Jerry for the beautiful piano playing. Thank you. Live well with cancer? You may not believe that is possible. As a 2-time cancer survivor, I know that it is possible to live well with cancer. I want to share with you hope and encouragement that you can too. That is why I began the Living Well with Cancer program at Cashman Center. Our program exists to support you to live well with cancer. At Cashman Center, living well with cancer means managing physical symptoms and or emotional pain, being able to enjoy activities with our children and grandchildren, appreciating the beautiful fall leaves, uncertain of the future yet grateful, comfort in knowing you are sharing your journey with others who have cancer, helping you to find and connect with the resources you need to help you live well with cancer. At Cashman Center, you will experience being cared for as a whole person by providers who understand that cancer is affecting all aspects of your life. Living well with cancer is more than just surviving. It's about living a whole life, embracing love, family, and faith. The Living Well with Cancer program is a program within Cashman Center. Cashman Center is a holistic mental health center. You can find information about us on the resource table in the back and online. Cashman Center staff are in beautiful blue golf shirts. Haha, I was rageful when I got up this morning putting this on. And then I turned grateful quickly, and are available to answer any questions you have. So thank you for being a part of tonight's conversation.
Good evening. I am Kelly Huegel, and I am the Community Outreach Director for the Cashman Center. And unfortunately, I had not heard of the Cashman Center until about 4 months ago. And now I work for them, but only for the last couple months. My cancer journey began 4 years ago when my husband was diagnosed with neuroendocrine cancer and was given 6 months to 2 years to live. He passed away 10 and a half months later at the age of 44. Our children were 7 and 10 at the time and are now 10 and 13. And I wish I had known about the Cashman Center at that time. I wish I had known of the alternative therapies available that could have possibly helped alleviate some of the extreme pain he was in as a result of his liver being covered with tumors. I also wish I would have known of it even in the last 3 years to help my son manage his symptoms of depression and anxiety as a result of losing his dad. My goal is to inform and educate people of the other possibilities and alternative therapies and options that are out there so that can help you better heal through this journey. Thank you.
Good evening. My name is Jim Marschall. I'm currently serving as coordinator of pastoral care ministries and justice and service ministries at All Saints Catholic Church in Lakeville. I also served there as deacon. I was ordained a deacon for the Archdiocese of St. Paul and Minneapolis in 1999. My wife Jenny and I have lived in Lakeville for about 30 years. We have 2 daughters who are 27 and 24. I know I don't look that old, but I am. My role here this evening is to kind of be a voice of the faith community, and how the faith community can be a resource and a support to people who are dealing with a cancer diagnosis, to their loved ones, their family, and to anybody in need. I've had, I'm going to call it the opportunity because it has had its blessings, the opportunity of being a part of the journey for a lot of people who've battled cancer. Most recently and most closely, my brother-in-law, 43 years old, was diagnosed in September of 2013 with stage 4 metastatic melanoma, and he passed away this past February. My sister and their 3 kids, who are now 16, 14, and 11, are on that journey with a lot of very strong support around them. So it's both, for me, both touches home professionally, but also very much personally. Thank you.
Good evening. My name is Barb Sabol. I am a wife, a mother, a cancer survivor, an oncology nurse, and a parish nurse. I worked with Deacon Jim at All Saints for about 5 years, actively in parish nursing, and I'm consulted by him when circumstances arise and help whenever I can with my healthcare background. I do go and visit folks in their homes as part of parish nursing ministry, but also now as a Eucharistic caregiver for the church. I hope that I can answer any questions you may have about faith community nursing and where you might be able to find your resources in that, and any questions you may have about the inpatient environment. I currently work at the University of Minnesota on the surgical oncology unit. Thanks.
Hi, my name is Heidi Mogush. I am the voice of the patient on this panel. 5 years ago, when I was just 32, I was diagnosed with breast cancer. I had a 1-year-old baby and a 4-year-old son as well. And we treated it with surgery and chemotherapy, and I was blessed to also ask the right questions and know the right people that could help me also use healing touch and acupuncture to really thrive through my cancer treatment. I would say cancer broke my heart, and cancer also helped it to heal. Having such wonderful support and kind of all the right things at the right time have helped me be more of who I am now, and more than I ever could have been without it. So I'm here to help those of you dealing with cancer know that you can have that too.
Hello, hello, hello. I already broke the rule. Don't get near the speakers. Hi, my name is Jana Shortal. I'm a reporter for KARE 11 News, and I am here just to be your moderator. Not here to get in the way. I'm here to take all the index cards with questions, make sure that goes fluidly, because that's the second job of a news reporter, is to act as these types of things, right? All of these people have all of the information. So it's an honor to be here tonight. I've only recently become knowledgeable about the Cashman Center, and when I became knowledgeable about it, I wanted to be a part of tonight's events because I think the work that they do is really beautiful, and I think it's really important, and the more people that know about it, the more people can utilize it. So it's an honor for me to be here tonight, and my first line of duty is to introduce our keynote speaker, Dr. Gregory Plotnikoff. In your program, you can read all of the things he's really good at and why he's qualified to be here. I asked him if I could not read that because some of those words were big. And I asked if I could just introduce him the way he would like to be introduced. So he promises to be a provocative speaker tonight. I don't think that that's anything that you can't tell your children about. He wants to entertain you and inform you and be helpful to you, answer any questions that you may have. Nothing's really outside the box. We're just having a conversation here. There just happens to be microphones. So ask what you want to ask. That's why we're here. So Dr. Plotnikoff.
And I want to say thank you to Kathryn and all of the Cashman Center for making this evening possible. I hope that this will be helpful, meaningful, fun, and a dialogue. And also to the panelists, as they bring a passion, they bring experience, they bring a lot to this. And so we're looking forward to a really good dialogue. Now, the risk is I'm a physician. The risk is that it could end up being a monologue. And I'm going to trust friends in the audience to stand up and just go, if that's going to be the case. But we are here tonight either as cancer survivors or co-survivors. And I'm wearing the pink because this is October, and I'm wearing the white because this is the co-survivors. And in particular, it is a tough role to be a co-survivor, just like it's a tough role to be a survivor. And I really want to discuss both of these in some detail tonight. The co-survivor and the survivorship, co-survivors are there for information, for emotional support, and for practical help. And I hope tonight is going to be informative and give you some guidance on how to provide emotional support. Because all of us want to help and just kind of, what does it take to do that? And I also want this to be, have some nice practical, informative things. We've got lots of time for dialogue. No one's going to go away disappointed, I hope. We'll hang around for questions. But let me tell you a little bit about the flow. And that is, I want to talk for a few minutes on a couple of different topics. Then I'm going to sit down, and the questions that you wrote down on your cards to begin with will then generate the dialogue here, and that Jana will moderate and bring in as appropriate kind of ongoing questions, concerns. Hopefully, I'm going to provide some kind of stimulus that will generate questions on your part. If I'm really provocative, that will be a good thing. And so that is my hope. Okay, so people say, Plotnikoff, are you going to talk about alternative medicine? And I want to say, no, I'm not anti-anything. I'm talking about what's next. I'm going to talk about make reference to next generation medicine. In my clinical practice in St. Paul, Minnesota Natural Medicine, or in Minneapolis, Minnesota Personalized Medicine, a strong focus on the new sciences of genomics, metabolomics, microbiomics. We can get into those if you're interested. Additionally, I wanted to introduce myself as a bridger, and that is East and West, science and spirituality, heart and mind, body and soul. That's what I feel passionately about. And it's really not alternative, it's really and or plus. And so I want to honor and revere all the best of conventional medicine and maybe take it a little bit further. But cancer, oh my goodness, what a challenging thing. It kind of throws us into this vortex. So I should tell you a little bit about the messenger before I share something about the message. And it was a very conscious choice of me to go to divinity school before medical school. I had won an essay contest sophomore year of college. It took me to the first international conference on human values in London. And there I met leaders of the hospice movement. And this was 1981, and hospice was a pretty radical concept in the United States. Most people have never heard the word before. And I found it very moving. I said, wow, compassionate care. And so it was very, very inspiring. And I thought, well, shouldn't this be part of all of medicine? But I said, well, I came back to Minnesota, started volunteering, worked with great nurses, great chaplains, and I made a very conscious decision to go to divinity school before medical school. My parents were so disappointed. It was kind of like, I said, I'm going to go to Harvard, and they said, what? I said, oh, I really want to study with Henry Nouwen and Diana Eck, and they go, what? I said, oh, I'd really like to be on some time in the East Coast. And it's like, what? It kept going on. And they said, oh, Greg, If you really want a master's before medical school, why don't you do something practical like biochemistry or immunology? Well, in fact, it turned out to be the most practical thing ever for me. I trained as a hospital chaplain and then started medical school. I went from being in small groups where we discussed concepts and the history of ideas into a large classroom where someone went blah, 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 blah. Here are the following facts you need to know. We won't tell you why outside of context. And I discovered some incredibly important things were missing from the curriculum. Healing, suffering, it's like nutrition, death and dying. All kinds of things were missing from the curriculum. And so in fact, there was a curriculum, there's a missing curriculum, and we discovered there's a hidden curriculum. The hidden curriculum is, number one, is nutrition has no relationship to health. And I can't tell you how many physicians tell me that today. No, there's no connection between what you eat and your state of your health. Second thing is there's a very interesting definition of what is normal and who is normal. Very political questions. So back then, what is normal was a straight white male, capitalist Christian, English-speaking, Northern European heritage, approximately age 23. And as I looked around my med school classroom, that's who I saw. Third issue that came up was that there are no real ethical dilemmas. They're just things waiting a technical fix. And if it doesn't work the first time, put more and more of technology at play, and you'll get to it. There's a big difference between a technical fix and working around some other things. The technical fix is you walk into a dark room, where's the light switch? And it's kind of an adaptive response would be you walk into a room and there's no light switch, what now do you do? Now nurses understand this really well, but it's been missing from the physician curriculum. Likewise, back then physicians were seen as self-sufficient virtuosos. That was the model. We carry it all on our shoulders. There's no such thing as a team. If there is a team, then the style is command and control. And so I rejected all of those ideas, and so we worked very hard to create a shadow curriculum. And so since starting med school in 1985, I've been part of the shadow curriculum of sorts. But I strongly believe in a healthy body, and a healthy mind, and a healthy spirit, and we'll talk about those, I'm sure, tonight. One new dimension I want to do is talk about a healthy community. Ed Ellinger, our current Commissioner of Health, shared this quote from Wendell Berry. The community is in the fullest sense is the smallest unit of health. To speak of the health of an isolated individual is a contradiction in terms. So it's very interesting. I spent 6 years as a professor at Keio Medical School in Tokyo. I'd gone for 2 years to study traditional Japanese herbal medicine. There's medical students that were being taught to prescribe ancient multi-herb formulas that are approved by their FDA, covered by the National Health Plan, and widely used, including in oncology, and we knew nothing about them. I said, so I'm going to go learn. I planned to go for 2 years. And discovered to really learn, I actually need to really learn the Japanese language. So I ended up spending 6 or so years there. But one of the things that I'm going to share with you about this is that in the Japanese language, every character has a beautiful poem in it. One of the simplest characters is this for person. It was described, and I said, tell me, how does this, and it kind of looks like a person, I think, but how did this come to be a person? And without any variation across Japan, people said, a person is, yes, a one, but they always have support. I said, this is very different than autonomy in the US, where as Kant said, one's humanity is defined by one's degree of independence from the wills of others. But I found in Japan, one's humanity is defined by one's degree of connection with others. So I come back to this theme of community, co-survivorship. We're in this together. The white and the pink. So in Japan, I had, you can imagine, all kinds of new images, all kinds of new things that reflect a culture very different from ours. And yes, we have this character, but I want to share with you also something about the language that I think by stepping out of our comfort zone, we can see something new and important in our own culture, and we can draw upon it. So if we take the character for person and tie it with the character for tree, the two things come together in a new word. Like, what is the connection between person and tree? It's rest. So everything is kind of a Jeopardy question. Now I share this with you. We're going to get to practical stuff, but I share this with you because it opens up all kinds of new things. It's kind of under the tree is understood. And so it's this idea that what I want to share with you is that truth sometimes is not found in measurement, one of the hidden curriculums of the medical school. Truth is only found in measurement. As the chairman of one department said, I wouldn't believe anything unless it was proven by a double-blind randomized controlled trial. And she was serious. I said, excuse me, there's never been a randomized controlled trial of prunes for constipation. She didn't respond to that. All right, so getting to the heart of the matter. Here's an interesting character. It looks like something from the state fair. You know, my marshmallows on a stick. In fact, this is the character meaning to pierce. Now, it's used with things like relate to barbecues and things like that. So you say, oh, Japanese isn't such a tough language. And then if we add the character for the metaphoric heart, kind of the metaphoric heart, the poetic heart, the soul, perhaps, we put the two together, we have the new character. And this new character is the word for patient. A patient is someone whose heart has been pierced. Or a patient is someone who pierces our heart. So this speaks to why, as survivors and co-survivors, community is so important, and why tonight the theme running through all our things is going to be coming back to heart. Now, some other things, quick things about Japan. When I was checking a patient out of the hospital, the best box I could check for in the government form was this character here, 2 characters. And I didn't think much of it because I wasn't reading the language very well at that time. I was just told, check that box. Okay, I'll check that box. And then one day, I kind of like fell out of my chair. The first character is the character for the verb to control, to govern, to fix, or to cure. I said, oh, I understand that. That's medicine. It's kind of like, it's particularly Western medicine. The second character, though, is quite stunning. The top left element signifies illness. The middle component is the character meaning to move or bring or convey. And there's that character for heart again. To bring heart to illness. This is the character for to heal. So the best possible box to check is both cure and heal, working together. Both. Not either or, not one. Both are necessary. Neither alone is sufficient. Best box to check. So, all right. So you were here to talk about cancer survivorship and co-survivorship. All right. I might go a little bit fast now. Feel free to raise your hand and to stop. Now I'm going to share a little bit of data. I promise not too much data, but I just want to let you know that if we think just about breast cancer alone, and since it's October, there's over nearly 3 million breast cancer survivors in the U.S., and upwards of 80% of them are using what is termed integrative medicine, and for all kinds of things. Prevention, treating side effects, quality of life issues, efficacy, minimizing side effects, wide variety of reasons, upwards of 80%. Now, where are people getting information? Most often not from their physicians, and that's why we have public forums like this. We're all in this together. Let's share what we're learning, and that's why I'm so glad we have the panel here tonight. Now, I serve as the chair of the Education Committee for the Society for Integrative Oncology, and one of our projects in recent years, we published last year in the Journal of the National Cancer Institute, was guidelines on integrative therapies for breast cancer. And this is a thorough review of the world's literature, all those randomized controlled trials, and we graded things by the U.S. Preventive Services Task Force, grade A, grade B, grade C, and I want to share you kind of a summary from this. Grade A, that is, there's a high certainty that their benefit is substantial. Substantial, hey, we like that. What constitutes grade A for breast cancer? Meditation, yoga, relaxation with imagery or guided imagery. The evidence is strong enough through multiple trials to say, yes, the benefit appears to be substantial. Wow. Talk about options, logical options to consider. Grade B, at least moderate certainty that net benefit is at least moderate to substantial. Yoga, massage therapy, music therapy, meditation. For these things, stress, anxiety, depression, fatigue, quality of life. Anyone here in the audience have a friend with cancer with any of those concerns? All right. Now, one of the things about randomized controlled trials is sometimes people get randomized to like one thing or another, and they say, oh, I really wanted the other thing. And that kind of confounds the trials. Actually, the best results come from where people are making conscious choices. I want to do acupuncture, I want to do yoga, I want to do guided imagery, I want to do guided imagery with Kathryn Cashman. You know, those conscious choices determine outcomes. Now, it's important to know as we think about logical options for people to consider mind-body therapies. And what are these? These are meditation, they're self-hypnosis, they're yoga, qigong, tai chi, relaxation, response. These are all things that, lo and behold, are, wow, low cost. In fact, I think for the most part, one could say these are free, low toxicity, non-invasive, fun, adventure, a new skill to learn, things that can be really good. Now, because this is supposed to be interactive, let's just do something right now. Take we're at halfway point of this talk. But it's an evening, and so those of you who are comfortable standing up, let's have you stand up. And we're going to do a little qigong exercise here. Now, this is an exercise that's about 2,500 years old. If you want to stand up too, but unlike yoga, it involves active sound. And so we're going to make an active sound. I call this a movement exercise, a energizing exercise, someone might call it a blowing off steam exercise. This is something because all of us as co-survivors are empaths. we feel the pain of others. And if we take that in and hold on to it, it's stuck. What we want to do is not block it. We want to take it in, but we want to help move it along its way, so we can be present for the next thing and ready for the next thing. So let me just show you real quickly. I'll walk through this, and then we'll do it together. Okay. So I'm going to get into a comfortable stance where I feel grounded, and I'm going to choose to close my eyes. Well, maybe not right now, but I'm just going to get into a breathing pattern where I'm breathing in through my nose and out through my mouth. And I'm going to blow out and lower my knees. Breathe in and stretch tall. I'm going to have us all go to our right side when we do this. And breathe in and breathe out. Okay, we'll do this to both sides. Let's do it to your right side first. And so, get into kind of a slow, comfortable, rhythmic breathing pattern. And when you're ready, let's breathe out and lower ourselves to the floor as you're comfortable. And at the bottom of your breath, turn hands up and start standing up and breathe in. And then go to your right side and yay. And then breathe in and breathe out. You see, feel flow? Let's do it to the other side. Breathe out and in, and to your left side, and breathe in and breathe out. Better and cheaper than coffee. Cool. Okay, feel free to have a seat. So, low cost, non-toxicity, non-interventionist. The idea is that we have this thing back and forth of calm body, calm mind. It's hard to have a calm mind when the body isn't calm. It's hard to have a calm body when the mind isn't calm. And so the idea about the mind-body exercises is to really kind of just focus on, you can start either way. Calm mind will lead to a calm body, lead to calm mind, calm body. So, calm mind, yoga has traditionally been understood as preparation for meditation. And so people who feel have kind of restless mind, some movement beforehand. We know there's at least one massage therapist in the room tonight who understands what a calm body can do for allowing for a calm mind. And so different approaches are really important, but I want you to keep this calm body, calm mind in set. It's really important. And of course, guided imagery. Gosh, who wouldn't want to be here? Music therapy. Now, music therapy is not having a musician come to your room and play for you. It's not necessarily putting on an, what do they call these, I something or others. 20th century, I'm stuck. But it actually is therapy. It actually is something that can be very, very powerful to do. Of course, one's spiritual life, prayer, ritual, and the like can bring a calm mind, a calm body. Or if it's enjoying the spectacular world in which we live in, or actual meditation. And there's been so much meditation research done that we can say that, yes, it can work, it can be good. So what can we say from it? Okay, we can say that multiple studies, and when we talk about multiple, we really mean multiple studies now, have showed decreased pain, significant effects on mood, including anxiety, insomnia. We don't necessarily need Ambien, and just generalized stress. Now, I have to step back and say one of the things maybe we'll want to talk about a little bit later is the 5 forms of stress. When I hear stress, I'm just going, stress? What do you mean by stress? Environmental, physical, emotional, spiritual, pharmaceutical, dietary, they all play a role. We can talk about those in more detail. But the nice thing about meditation is the more you do, the better you get. It's a little bit like playing the piano. No one plays the piano first time. It's a whole new skill set. And it's when mind calms, of course, ideas float in. It's a whole new skill set to allow them to float in and to float out. So, a little mind game here. In the next 5 minutes, whatever you do, don't think of an elephant. So what did we learn as kids? Set your mind on a goal and work, work, work. I'm not going to think of an elephant, not going to think of an elephant, not going to think of... Whoops. I wasn't thinking of an elephant before, and now I'm constantly thinking of an elephant. So the idea is kind of not to fight it. You just say, oh, okay, let a thought float in, let it float out. I'm going to return to my breathing. And I'm not going to assign it any emotional value. Elephants, oh my goodness, it's kind of hunting in Africa, or state of zoos in the United States, or politics, or alcohol. No, not assigning any emotional value to it. Just saying, oh, there's a thought. I'm going to let it float in and float out. A whole new skill set. That takes practice. But now, we all want kind of resources. Here's something free. Self-hypnosis for relaxation and stress relief, video and MP3. If you go to Memorial Sloan Kettering Cancer Center, that's what we mean by mskcc.org/integrative medicine, there's a wide variety of resources there. Additionally, if you go to the iTunes store, there are all kinds of free downloadable meditations available for you there. It's just kind of, wow. And because a calm body is so important, and when we want, as a co-survivor, if we want to be helpful or someone, what are some things we can do? Well, besides cooking, we can actually bring touch. And here are some free internet courses on simple things that we can do for our friends and family. Chair massage, gentle massage, breathing techniques. These are all, again, available for free. And as you experience it, then, if you want to work with someone with a lot more experience in this, then you know exactly the questions and the resources you'd be looking for from that health professional. So, take 6 symptom management, SX, symptom management messages. So number 1, if you want to decrease stress, anxiety, agitation, then the approach is meditation, massage therapy, self-hypnosis. If you want to control pain, nausea and vomiting, stress, then the approach is acupuncture and mind-body therapies. To relieve constipation and get GI motility up and running, massage therapy is great. To restore salivation, what's called xerostomia, acupuncture. To improve range of motion, acupuncture. Restore function and enhance survival, fitness, nutrition, dietary supplements, and where appropriate, counseling. And it can include health coaching or it can include psychotherapy. So I'm hoping that we're going to get on these topics so we can talk about them a little bit more. But our goal is, again, how to be great survivors, how to be great co-survivors. And these really require courageous conversations. We all want to be helpful. We all want to be helpful. And this actually is a particular risk. But the risk is that we're not present. So I want to share an illustrative story regarding this. So, first day as a hospital chaplain. I'm 23, and I'm kind of full of myself. And I said, well, I've been a hospice volunteer. So first day of chaplaincy, I was assigned to a ward of 36 people. And in my second year at divinity school, I thought I was so ready. And I'm just like, hi, I'm Greg. I'm going to be the chaplain this year. Nice to meet you. And everyone said, oh, hi, nice to meet you, blah, blah, blah. See you around. Person after person after person. Until the very last person. A woman named Chris who had had a laryngectomy. She couldn't speak. She could only write. Said, hi, I'm Greg. Nice to meet you. I'll be the chaplain this year. I'm from Minnesota, or something like whatever I did at that time. And I expect her to write back to me, oh, hi, nice to meet you. See you around. But instead, she wrote back to me, I blame God for this. And when you're stressed out, you regress a couple of developmental stages. So there I was, just like, I don't know what I said, but I said something along the lines of, I'm going to go to the library and I'm going to find you the answer. Oops. She never spoke to me, or never wrote to me again. I had blown it. What instead if I responded back? Tell me about this. Would that have opened up a conversation? Would that have opened up a relationship? A relationship where we can connect as fellow human beings rather than as an expert with answers or access to a library. It's a very, very different thing. But I discovered that in our culture, we are all trained to be answer givers. We can see it in kids as early as age 2 or second or third grade. And we certainly see it in adults after 26th grade. Have I got the answers for you? In fact, your answers ought to be my answers. It's like, no. So our challenge is to be the presence. And in order to be fully present to people, it's such an important gift we can give people. I love this from the psychologist Carl Rogers. The gentle and sensitive companionship of an empathic stance, again, listening with heart, provides illumination and healing. Deep understanding is, I believe, the most precious gift one can give to another. So as survivors and co-survivors, that's why I want to kind of emphasize in the time that I have for this is to talk about the key point for presence is to recognize and bracket our emotional needs. When we're faced with something painful, I blame God for this. The natural response is to try to fix it, or, oh, it's okay, you don't need to worry, or it's a very different thing to say, oh boy, my buttons are pushed, but I'm not responding to my discomfort, I want to respond to the person's discomfort. And that means really just saying a simple thing like, tell me about it. Opening up the thing. So questions I found really helpful, they're kind of nice to know about, or just kind of actually response. Tell me about it, or can you tell me about it? Can you tell me further? What does this mean for you? Related things are, how can I be most helpful? And this is a very important nuance. It's very different than how can I help you? How can I help you? How can I be helpful? Co-survivorship. And what's most important to you this hour, this week, this month, this year? What's most important to you? From those points, then good things will come. And I think that's where we can be present and helpful, rather than wanting to fall into the trap of having answers and trying to fix. So I want to just conclude with here with just one other thing. This is kind of a fun character. It has 3 elements to it. The first element means to lift up or rise up. The element right below that is back of the throat. And this is the character for sound, as in, say, ah. What happens? The back of the throat lifts up and there is sound. Now, if we add this character for sound to this metaphoric heart again, returning to the heart theme, we have a new character. This is meaning. Meaning is sounds of the heart. When we hear things which are meaningful, they are coming from the heart. If we add the character for taste or flavor, we have a whole new thing. Now, taste or flavor is really interesting from our culture. Taste in English comes from what touches our tongue, and that's the root of the language. But in Asian cultures, it's mouth, and you see that square, and the character not yet, a tree which isn't fully bloomed. So taste or flavor is not yet the mouth. It's what we see, it's what we hear, it's what we smell, it's the people we're with, it's the setting we're in, all determine taste or flavor. And if you've ever been on a cold, miserable day in the Boundary Waters, macaroni and cheese out of a box can be absolutely delicious. And that's what I mean by that. But if we combine these two, that is, if we can, that is meaning and taste or flavor. That is, if we can taste the meaning, we have a whole new character, meaning significance. If we can taste the meaning, we understand the significance. And this is, again, Carl Rogers, and to kind of affirm the role of psychology in all this, is to hear the words, the thoughts, the feeling tones, the personal meaning, to hear that. Even the meaning is below the conscious intent of the speaker. In that deep human cry lies really the sounds of the heart, and that's where I want to connect. And we don't connect as experts, we don't connect as people with answers, we connect as fellow human beings with imperfections. So, last character, to care. Okay, you see on the right-hand side, we've got meaning, and the left-hand side is the character pronounced kai, which means to assist or to support. And kai is kind of interesting. Japan is full of puns. So kai also means to meet, as a meeting, and also means right here, right now. So, right here, right now, to meet, to support meaning is to care. In this moment right now, supporting meaning, supporting the sounds of the heart is to care. And from caring comes courage. And that is our hope. So, I hope it's been provocative. I can cover all kinds of things. Our panel is here. We're looking forward to your questions because I want to address issues which are of practical importance, and that I want to make sure your questions are answered tonight. And I'm sure that I'm hoping that I've been provocative. So, thank you.
Thank you, sir.
Okay.
Hopefully, if you had some questions, you got to write them down. The question is for anyone that can chime in on this. Can you talk about cancer rehab and its role?
Well, I guess I can start. Cancer rehab in terms of post-operative rehab, perhaps, or post-therapy rehab? I'll go both ways. I work with surgical oncology patients at the University of Minnesota, and we frequently will discharge folks with physical therapy and occupational therapy in the home environment if they're not able to come into the clinic environment to gain strength and hopefully get back to baseline what their physical abilities were before they came to us for their surgical treatment. As far as the clinical setting with, you're getting chemotherapy as an outpatient, and I think maybe, I bet you Kathryn can speak to this, how we follow you in terms of helping you maintain your strength and things through treatment can be handled in an outpatient environment or a place just like this at the Cashman Center with the alternatives available. I don't know if that really answers the question.
I have a much less doctory perspective. But I would say this, when we're talking about recovering from cancer treatment, we're talking about years here. Nobody tells you that, really. But you need to know that it's a long, long time, much longer than we want it to be. We're talking about healing all sorts of different parts of your body. Maybe not just the cancer sites, but all the other things, medical interventions that have to be done also have to heal. A little surgery here, a little something there, a little take that port out, whatever it is. You're healing from the toxic drugs that you may have to take. And no one would ever really answer me about that one. How long is it gonna take? Well, it's different for everybody. And then you got a broken heart too. You gotta heal that up somehow. And that takes, all of those things keep coming back for years. It's not just, well, when are you cancer free, or when is it over? Oh, it's over, yay, it's over. It's been 3 years, it's been whatever. Because it's like a country song, really. They talk about, oh, a certain melody or a certain smell brings it back. Well, all the parts of your life bring back cancer to you, and you have to heal from all of that every time one of those little snippets comes out and touches the cancer part of your broken heart. So plan on a really long time.
So thank you for raising the issue about the broken heart. As that's something that is can be different for everyone in so many ways. Suffering I've always understood as being related to losses. And part of it is loss of self-image. Part of it can be loss of function. Part of it also can be our loss of sense of invulnerability. As my body has betrayed me, how could this happen? This isn't fair. Oh, my left toe has been aching for 2 days now. Oh no, it's back. Oh, these are things that, when you talk about the broken heart, that's why I think this really cancer survivorship and co-survivorship is so much about the heart. Now, some practical things along that line is that there are really good cancer rehabilitation people here in town. There's a national standardizing organization called STAR, which I can't recall exactly what it stands for, but it's out of a rehab team at Harvard Spalding Hospital. And part of that is to really kind of look at overall function. It includes lymphedema issues, it includes sexuality issues, and so a lot of things about the morbidity-related issues of treatment that can be addressed, and it's a whole area of specialty in medicine in order to do so. And so I think that is something that is going to be very important. I just have to say about detox. Detox is a hot topic these days. And it's true that there is much we can do to support our body's detoxification pathways. Number one, cruciferous vegetables. Think of broccoli, Brussels sprouts, cauliflower, kale, rutabaga, arugula, watercress. These are all very supportive of our body's capacity to detoxify. And it's really important to have those things on board because detoxification actually is a two-step process, and they support the second step. If you have really good functioning first step and not so good functioning second step, that's a bad thing. We don't want that. Example, Tylenol. Tylenol is a safe drug by itself, but it actually gets transformed by the liver into a toxin that by its first step. And it needs a second step to get past that. It also needs a lot of something called glutathione, our body's largest natural antioxidant. If we are low in glutathione and low in second phase detoxification capacity, we get Tylenol toxicity. So that's really something to know. People on high-dose Tylenol long periods of time is not a good thing unless we can ensure good glutathione and good second phase detoxification pathway function. We can look at first phase detoxification pathway through genomics now, and these are called the P450s, the CYP enzymes. And they go by names like 2D6 and 3A4 and 1A1 and 1A2 and 1B1 and the like. 2D6 is a really important one for us to know about because it is involved in turning tamoxifen into an active drug. We don't have good 2D6 function. Tamoxifen does not get turned into a good drug. Codeine does not get turned into morphine. And the list goes on and on. And so we now have the capacity to do it. It's cheap. It's $99 from 23andMe. And an additional $20 for a kind of an organizing website like livewello.com. We can talk about that more later, but these are things that, when we talk about next generation medicine, this fact that this is something cheap and easy to do and something we all will be doing. It will be standard of care, but right now, unfortunately, it isn't, but it's in your power to do. It's the best $99 one can spend, I think, in healthcare right now after vitamin D. And so it gives us good insight on how to customize and personalize an approach for people.
What are some of the most pressing needs of cancer patients or cancer survivors?
I can say as a caregiver and now living with 2 children without their dad, counseling, mental health from the second he was diagnosed, and I heard those words. It changed our lives forever. And it's everybody. It's the patient. It's the spouse or caregiver, the children, the parents of the person who's diagnosed, no matter how old they are, friends. My husband has a couple of friends that for a couple of years they struggled. So I think mental health and again, what I'm learning is alternative therapies that can help with that. Healing touch, I'm just learning about acupuncture. I wish I knew everything that went along with that. I'm brand new to the Cashman Center and really just eager to learn because traditional medicine hasn't helped completely. And I know when Dave was sick and he was in so much pain, those really, really could have helped. And then when I look at my son, who's 13 and struggles with anxiety and depression, every time a new sport starts and his dad's not there to coach him, Father's Day, my daughter, it's Valentine's Day. How can I get them through this? We're on a roll and things seem good, and then something comes up and we're back down that road again. It's like starting all over. And what are some other things that can help us? I'm very curious about meditation and my own stress. It's incredibly stressful being an only parent. My kids are at home right now, and getting text messages before this started, and hopefully, everything goes well for 2 hours because I'm not checking my phone. It's a day-to-day thing. It's a constant. I lost my job a week after my husband's funeral. I was unemployed for 6 months. A blessing in disguise. I was home with my kids. I'm a good budgeter. I was able to handle it. But, this is my 5th job in 3 years. And I believe God brought me here into the right spot and to Kathryn Cashman. But it's a long haul, a long process. And it's support of any kind. But knowing that there is more out there. And I was very vocal searching for anything when he was sick. We went and worked through the Angel Foundation, and they were wonderful. But never did anybody tell me about these alternative therapies that could possibly help. I found out on my own for my son that when he is struggling with depression, that keeping him on a sleeping pattern and a better eating pattern helps manage his depression better. Well, there's nutrition counseling at the Cashman Center. There's so many options.
I tend to see people at the very beginning phase of their diagnosis and treatment, and they're in crisis, and they don't know what to do, and they don't know where to turn, and all they have is us at the bedside with chaplaincy, and we also have healing touch and massage and acupuncture and things like that available in the inpatient environment. But they need to unload on us, or tend to unload on us, and in sometimes not the most appropriate way, and that's okay, because you're in crisis, and our job, and we feel our job is to meet you where you are and try to get you to the next place so that you can find healing in your spiritual life, in your physical body, and try to connect you with the resources that we're talking about here tonight. So, not knowing where everybody is in their lives, I can say with honesty that I would love to, and I try to encourage people to not be quite so reactionary, and help us help you with some of these alternative therapies and mindfulness, relaxation, those kinds of things. We've seen wonderful results from that in a short period of time if you're open to it, and I would encourage that.
I might add that on the day I met with a surgical oncologist that laid out my cancer for me, the prognosis, what it was, what we had to do, what was coming in my months of treatment. Somehow I had the wherewithal to say, okay, we're going to do all that stuff. What else can I do to help myself through this? What's going to make it easier for me? And he didn't hesitate. He said, healing touch and acupuncture. So I did it. And it made a world of difference for me. I think we all know, if we listen to our inner compass, what might be the right thing for you if you are actively searching and learning about things. I don't know, somehow it seems like our hearts guide us to the thing that might be most helpful. And that certainly was true for me.
Can you kind of expand on that? Because that was our next question. Specifically, how did healing touch and acupuncture help you for your journey?
Sure, but I had just taken it a few months before I found out I had cancer. So when I found out, I emailed a few people from my church that I knew that did healing touch. And one of them, Cheryl, who's here from the Cashman Center, just kind of dropped everything and said, you have to have a session. I had a very quick progression in my treatment. I found out on Tuesday. I met with the doctor Wednesday. I had surgery on Monday. Boom. just get it done. But I had a lot to process, and I had Healing Touch. It's a energy therapy of clearing energy from your body and opening the energy centers of your body. So I had Healing Touch before surgery, and eventually added acupuncture, and we kind of created a plan where I would have acupuncture the day before chemotherapy, so I would be as strong as I could be right before all those chemotherapy drugs, and then I would have Healing Touch 1 week after, and every week, acupuncture, Healing Touch, acupuncture, Healing Touch. For me, it was how I dealt with all of it. I had a baby at home, I had a little boy, a preschooler at home, had a lot to keep together, as any cancer patient does. But I remember going into one Healing Touch session in particular, but it happened again and again with both therapies. I would go in weepy, overwhelmed, exhausted, whatever it was that day, and come out of that session feeling like, oh, I just processed all of this. I'm fine. I can do this. No problem. And then I would. So it's, I don't know, transformative, I think.
If you didn't hear Erin, she was asking about insurance, which was another one of the questions. Basically, if any of this was covered by insurance, right? Is that what you're asking?
Well,
Healing
yeah,
Touch,
I mean,
acupuncture.
often- Yeah, I mean, often they're not
Yeah.
cheap for everyone, or everyone can afford it, especially on top of, your medical bills. You're going through cancer.
Yeah, so it's important to know about other options along this line. Number one, here in town, Pathways is worth checking out. pathwaysminneapolis.org, and they have a brochure outside. And it's all volunteer health professionals there who provide services at no cost. And it survives on donations from the community. So that's one option. Second thing is thinking about preparation for events, chemo, radiation, surgery, and like. There is a large study published in 2004 showing that guided imagery done before breast biopsy or mastectomy significantly reduced pain, anxiety, and cost. What year was that? 2004? And it had 200 people in it, randomized, double-blind, placebo-controlled trial. Or you say, oh, Plotnikoff, there is a radical in you, isn't there? But I think the big thing is, what else can I do? What else can we do? Spirituality, tell us about that. It's come up a couple times, and I think of every illness being a spiritual crisis and an opportunity for spiritual growth as well. So I'm wondering, in your role in pastoral care, what you would answer the question about what else can be done.
Well, I think one of the things that we're starting to catch on to in our world, in our culture, is that, and it shows as practices like Cashman Center and others become more integrated, is that we're integrated people. We're not compartmentalized. We're physical, we're spiritual, we have a soul, we have a mind, and it all works together. And so it all has to be treated, and it can be really easy to overlook. And also on the level of spiritual, it can be real easy to think, well, I'm not religious. A lot of people aren't religious. Everybody's spiritual. We all have that part of ourselves. If one is connected with a faith community, that can be an incredible source of support. Even if one is not connected with a faith community, there are still ways to get the support for that spiritual part of oneself, that part of the whole. And I think the first step can be just understanding that. And I find in my own experience that understanding that's a lifelong journey. You know, it's not something that you go to divinity school and you have figured out, right? That, yeah.
I didn't never find that book in the library.
Yeah. It's not on the library, it's not on the internet, you know. There's a lot of things that can help answer those kind of questions, but that's a lifelong journey, is understanding our spiritual self. And in an experience like being diagnosed and having to treat a serious illness like cancer, it affects us spiritually. And so you want to circle the wagons around that part of our lives as well. I couldn't help but think, Heidi, especially when I was listening to what you said, I found myself thinking about trauma. And the first thought I had was, well, wow, going through these kind of things in our body, that's a lot like experiencing trauma. Well, it's not a lot like it, it is. And being aware of the fact that kind of an experience, whether it's dealing with surgery, the effects of chemotherapy and that sort of thing, we need to look at it the same way we would look at somebody who's experienced any other form of trauma, physical abuse or sexual abuse, or and I think of the traumatic experiences of people who are involved in combat situations. It may even be so far as to even leave somebody with some post-traumatic stress disorder, to be able to recognize that. I'm crossing over into the psychological now, and it's not my area, but I've had the chance to learn a little bit on that too. But I couldn't help but think of that when you were talking about a few things earlier, Heidi, in your experience. Our bodies get traumatized. I think you've probably heard this, Greg, referring to the classic forms of treating cancer as slash, poison, and burn, referring to surgery and chemotherapy and radiation. That's hard on the body. It's hard on the body, it's hard on the soul, it's hard on the mind and the spirit. And understanding that we are integrated people, I think, is the first step toward understanding that we have to treat our whole selves when we're going through something like that.
Yeah, mind, body, and spirit are all interconnected. I like that thing about that we're not compartmentalized, which is really funny because, of course, medical school is taught on compartments. We have the liver compartment, the lung compartment, the heart compartment, and our doctors follow that. And so many people then feel frustrated when they're faced with something and the doctor says, well, it's not the left kidney, well, what is it? Well, it's not the left kidney. So it goes to someone else, well, it's not the right atrium, and it's not, and people kind of fall into this kind of like, well, it's not in my organs, so therefore, well, in fact, actually, maybe it's in all the organs, and we need to take a look at that. And it comes back to this whole thing about there's a huge difference between treating a heart attack and fixing a broken heart. It's just, how do we mend a broken heart? First of all, we have to acknowledge that they exist, and we have to kind of own that. That's what this whole idea about technical fixes versus adaptive responses. The medical system is designed, and as I point out with the curriculum, it's actually designed to create people who are trained to think as technical fixes and not to think in adaptive responses. And so the big challenge to all of us as survivors and co-survivors is to say, okay, what is going to be the adaptive response here? And that is, number one is not falling, here's a general rule of mine, I said not falling into the passive role. It's so easy to fall into the passive role. When you hear a word like provider, you should cringe. That is a one-way street. If you hear a word like treatment plan, you should cringe. That is one-way street. No, I'm working with someone who is in a profession dedicated to the service of healing, and we're going to work on an action plan, not a treatment plan. Action plan. What are the steps I can take? And I really want people to own their recovery. The best recoveries come when you own your recovery.
Is to realize that my treatment is not about the doctor. It's not about the person who wants to bring me food. It's not about anybody else. It's about me and my plan and what's right for me. And if you have that in the forefront of your mind, then it becomes easier to say, oh, well, I'm not really comfortable with this. can you help me figure out how to be comfortable with X, Y, and Z? Is there somebody that can, whatever, just asking for what you need really takes you pretty far.
My concern is, I say, okay, here's a practical thing. Bring a friend. And bring a friend who can sit back and analyze the situation and not get drawn into the vortex and ask the questions for you. And bring a tape recorder. I think a tape recorder is great because then you can go back and say, did they say this or did they say that? I remember we talked about that, but what did they say? I just think a tape recorder is like a great, great idea. And
I was the friend for a girlfriend of mine, and she was an excellent note taker, but she would forget. She would tell me all of her laundry list of complaints, and then we would go to the doctor, and she wouldn't mention them at all. And then I would have to say, oh, Susie, did you want to mention this about your neuropathy on your feet, that you can't feel halfway down your feet? Oh, yeah. And he'd say, mm-hmm. And there were a lot of symptoms that she was having that she was afraid to bring up because she thought it would stop her treatment, delay her treatment, change her treatment in some way. And ultimately those were unfounded fears. But she was afraid when a push came to shove to not be able to say, she was not able to say what she wanted to say, but I was able to say that for her. And it was, she thanked me later for it because she wasn't able to do it herself. So do bring a friend, a notebook, a tape recorder.
Advocacy and a second set of ears. I'm at that point right now in my life where I have an 83-year-old mom who my sister and I have come to realize she can't go to her doctor's appointments alone anymore. She needs that second set of ears more than ever. Her problems right now are in some ways a little more straightforward. She's got nothing left in her shoulder, and she's experiencing excruciating pain. Last time she went to the doctor, we were talking about it afterwards. Again, here's why I need to be there, and my sister. Did you ask the doctor about surgery? No, he never brought it up. He never brought it up. She didn't answer my question. She didn't bring it up either. They're trying to avoid cutting into an 83-year-old woman's shoulder. They're trying other things. The other things aren't working, Mom. We need to look at surgery because you don't have to live with this pain. So there's an appointment coming up. My sister and I are going to be there, and we're going to bring up the S word. Although, considering some of the conversations that my sister and I have been having with my mom in recent days, she might actually bring it up. My mom comes from the old school, where you deferred to the authority of the physician. The doctor knows best. Just do what he tells you. Okay? If you watch the TV commercials these days for the medical community, it's all about being involved in your own treatment. I love the commercial where the guy comes to work and the coworker says, "How you doing today?" And he starts going into his rash. Nobody at work wants to know about your rash. And then they flip to the guy sitting in the exam room and he's talking to his doctor, and the doctor's listening and nodding and being very attentive, and it's a beautiful thing. That's what the medical community is advertising itself as, and that's good. That's what we need it to be.
Do any of you have any advice any of you could give any advice to mental health professionals working with people dealing with cancer, people living with cancer, people battling cancer?
Don't tell me what I need to do or how I need to do it. Ask me and let me tell you.
I'll repeat the trauma thing. Being aware of the traumatic effects of the things people are going through, whether it's cancer or any other health issue that might bring that.
I feel very strongly that in life, the best answers, the most important answers to life's most pressing questions are always found rather than given. And I understand my role as a health professional is to support that search. My answers ought not be your answers. But I will be really happy when you find your answers. And along that line for mental health professionals is that you understand the inner wounded child really well. And you understand that we human beings are covered with emotional wounds. And some of us cover them a little bit better than others, but we all have them. And when they get touched, deep pain is evoked. And that can include issues of trust, issues with authority, issues with feeling loved or lovable, issues of feeling enough, issues of shame, and cancer treatment can exacerbate all of these. And so that's why I think that the ideal cancer care team includes people who can respond as a health professional to these, and include development of a supportive community around to support people and hold them as they go through these shifts. And these can be really important. And depression does not mean, it should not fall into the pill for every ill paradigm that many of us are trained in. It has a lot to do with, it's kind of addressing our own brokenness, and it can be done with spiritual care professionals, it can be done with psychological care professionals, but I worry if people go through cancer care and these deep wounds from earlier in life aren't addressed. I can't imagine how recovery could be optimal. And that's why I go back to this idea about, every diagnosis is a spiritual crisis and an opportunity for spiritual growth. And Penny George spoke last week, and she talked about, with her cancer diagnosis, she said she would ask everyone to ponder what invitation exists in their experience. She said, I don't know what it would be for everyone, but it exists. What invitation is waiting to be opened? And I think that's where people skilled in psychological and pastoral care can really help process those and take it further. Ruth, that provoked something, yes.
For some reason, the words death and dying provoke one attitude and feeling within people. But I think that within the cancer community, there needs to be more emphasis on loss and grieving, because cancer is a major change in your life, and no matter what the cancer is that you've had, or no matter what the degree of treatment or the length of treatment or whatever it is, there is that change, and it brings loss of hopes and dreams and things that you thought that you were going to be able to do. And if somehow cancer patients can be encouraged along the way to identify what is lost by this, and then to ask themselves the questions of what is truly lost, what remains, what's left of you, and then what is possible. And that's the invitation, is being able to really say what is still possible for you, no matter what stage of cancer you have. There are possibilities, short-term, long-term, there are possibilities. And I think that if we can look at loss and grieving, and really identify the fact that we're grieving, and that the grieving, just as you said, Heidi, grieving doesn't end. Years later, you still run into something and you say, oh, heck, there's a grieving moment. Kind of tied to my cancer right there. But I mean, do any of you at all enter into conversations about grieving?
All the time. All the time. In my professional work at the hospital, people are losing body parts. They're getting things they never expected placed on their body that won't go away. It's a constant conversation that we're having with them. And I also recognize, I've got one lady in particular in mind who is getting a very particular form of chemotherapy that she can only get with us in the hospital. And she's nearing her last round of treatment before she moves on to the next phase. And as her primary nurse, I've been kind of exploring with her, you know you're going to be done with us soon. I know you come in here every 3 weeks, but you are going to be done with us soon, and we won't be seeing you. And that's another loss that you're experiencing. And to recognize that, identify that, name it, and deal with it are really, really important things so that you can continue on the path that you've set for yourself in terms of healing. So for us, it comes up all the time, and then in my role at the church, always, and I'll let you speak to that.
Mine may be different than everybody's, might be a little bit different, but it's finding a new normal. And that's very difficult. And throughout the 3 years, the first year was all about honoring Dave and honoring my kid's daddy and doing something momentous on every occasion, the birthdays, the anniversaries, the Christmases, everything. And that was very difficult. And the next year was about doing whatever it took to just get through. And now we're on the 3rd year of some things, and it's a kind of a happy medium between them. And some things are difficult, like I wanted to take my son to the Wild games like his daddy did, and the Twins games, and we had to give up a few of those things because they're too emotional. But we did go to a Twins game this August, and none of us cried, and that was the first time. So, you know, you find your way. There's ups and downs. It's a roller coaster, and but you find your new normal.
One of the new normals for people is they sometimes refer to as doctor drop-off. And that is, they've been part of a supportive professional community, and then all of a sudden they're done and it's gone. And my fear about that is that they become passive and dependent upon this and have not strengthened their other resources. Is that a fair interpretation? Is that has anyone experienced doctor drop-off here? Yeah. I know what's the best response to that? Oh, Marie.
I have a question for you. So, being in the healthcare profession, I'm interested in feedback about how survivors and co-survivors give healthcare professionals the permission to discuss this with them. How the number of people are pushbacks when we talk about alternative medicine therapies, and I'm really sorry, but surgery isn't the right option. And so what would you say in response to patients and families that we in Western medicine have given permission to be, we're never gonna die. We're always gonna be healthy. It's a very interesting concept from the healthcare provider perspective to help us understand what we can do better in the long term.
I think honesty, you know, sometimes you do have to push, even if they don't like it. And again, I'm going from the caregiver. You know, the very last appointment I was with my husband and his parents in there, the doctor was trying to tell us, that this was it. You have to prepare yourself, but didn't quite say it exactly. And I'm like, oh, just say it, because they're not listening. And they're not. I mean, his parents were in denial till the morning I called them at the hospital and said, you need to get here now. And they even left at like, I don't know, 6:30 that night, even though he was doing bad, and luckily got the phone call and got back there before he died at 8:17. I mean, it's total denial. So for me, it was like, and they wouldn't listen to me. No one would listen to me. And me, it was like, you know, please, doctor, just say it. So maybe they still wouldn't, but they needed to hear it, and they didn't. And it's an ongoing struggle. You know, my mother-in-law told me just a couple weeks ago, I never believed he would die. And I said, Myrna, his very first prognosis was he was given 6 months to 2 years. You know, so it's very difficult for many people and in many different levels in many different ways.
I would like to think that professionals who go into oncology recognize and understand and are getting much better at having that conversation than they had in the past. 20 years ago, when I first started nursing, it was not a conversation that ever happened. And so it's better, I think, and nursing can support that. Our spiritual support can help with that. We will frequently have full team meetings at the bedside if we know that we're not all hearing the same message. We will frequently get everybody together and see if we can figure it out together and be very clear. I don't know if that answers your question, but I think it's getting better, but it's not there yet.
I think that from the healthcare profession standpoint, it's nice to have you as a co-caregiver or the person themselves actually give your healthcare provider permission to talk realistically with you. Because sometimes it's an uncomfortable, it can be uncomfortable. It's, I think it's an important step in the Western medicine versus Eastern medicine, where we are trained to talk about things like that, whereas in Western medicine, we're going to make you better. That's what our goal is.
Culturally, we've become much more sensitive too. We do see a very diverse population of people, and we know from what we've learned, you don't walk into certain ethnic groups' rooms and be particularly honest, because it's not consistent with their cultural beliefs, and you need to know who you're talking to, who you're supposed to talk to, and things like that. So I'm assuming you're speaking more as a homogenous group kind of thing, but we try. I'm speaking for the team I work with, we try.
Well, and that's where I'm impressed with having learned now being at Cashman Center, the Living Well with Cancer program that Kathryn just created and kicked off. It's not just a support group that we're used to and what I went through. It's giving tools on how to live a healthier life, and that might be how to talk to your doctor, because it was 10 and a half months from the day Dave was diagnosed to the day he died. You've got so much going on, you're in a bubble, you're just trying to get through every day, and that's me as a caregiver. That's not even being able to talk as how he felt. And he's dealing with the emotions of, he's not going to see his kids grow up and see his next birthday. So you don't know how to tell the medical professional that, and you're too in shock and everything too. So the Living Well with Cancer program, I truly believe, will help you deal with that, talk about it, bring it up, or talk about a will, talk about, all that kind of stuff too. There's so many things that you don't even think of, and then after the fact, in our case, it's like, oh, I should have said this, or I should have said that. So, a lot of different type of supports, but I believe that's something that's new, and definitely I didn't know anything about it. We didn't know anything about it. Even my main goal was, how am I going to help my kids through this, and how do I explain to them and tell them, because we knew he was going to die, and no one could tell me, and no one would. Even in our cancer support group, I remember one of the last days going, I came here for a reason, and I haven't gotten that answer yet. Someone, and even the day he died, the child life specialist came up, and I asked her, how do I tell them? Or, I don't know if he's going to die today and this is going to be the last time my kids see their daddy. It ended up to be, and I wish I would have handled it differently, but I didn't know, and she didn't tell me. My sister-in-law is a pediatrician. I asked her, she wouldn't tell me. When he died, I said, do I go get my kids? Do they come and see their daddy so they can say goodbye? No one could tell me or would tell me, and that might be just a personal thing. And I still struggle if I did the right thing. I didn't. And my 13-year-old son, sometimes I think it might have helped him. It might have, but we don't know. It might have also made it worse. So any kind of support, any kind of group, anything new out there that can make you think of those things that you're too in shock or whatever, overwhelmed to, is amazing.
I do want to tell you that the same thing I tell other people, which is you only get one chance to do this, and you do it the way it's best for you at the time. So it was the best for you at the time, and you didn't say anything wrong, and it's all fine.
Sorry, let me just put you on the spot, Dr. Plotnikoff. How close are we to having our insurance companies cover integrative medicine for cancer patients?
I can't answer very well for this, and we have no problems covering new medications at $110,000 per course because we've got FDA imprimaturs behind it. But in some sense, Jenna, maybe the question doesn't really matter because co-pays are becoming so ridiculously high right now, and the systems are even using language called capture. They want to capture these dollars, so they're against any willing provider laws that would allow any medical expenditure to count towards these deductibles. They say, no, you must spend it in our system to count as a deductible. So it's kind of a restraint of trade type thing, and that's why I think, oh boy, we're in for some major tumultuous events in healthcare because of the insurance industry and related concerns that right. That's why I think it's so important for forums like this to focus on what is it we can do for each other, low cost, low toxicity, and can we share and learn from each other?
The best resource for information, Doctor? Western, I guess. Internet? Friend.
Yes. You should be hooked in your clinics with if you are hooked in your clinics with a nurse navigator, start there and see if they can point you. If you're not, then whoever your nurse that you see when you walk in the door, have them point you. Internet's great, don't believe everything you read.
The Memorial Sloan Kettering Cancer Center website for /about-herbs, that is where all the media goes. It is where all people it's a very legitimate source for dietary supplements and herbal medicines and drug interactions and the like. About herbs, if you just Google that, that is a good resource.
This one's very specific from someone who is a massage therapist in the room that she doesn't specifically work with cancer patients, occasionally gets a client who is either a survivor or currently going through chemo or other treatment. How does she let them know she cares without sounding trite or giving false hope in a very short amount of time? Like what's appropriate? Maybe Heidi, I don't know if this is for you.
Start with your heart. Open your heart to that person and ask them what they need, and they'll tell you. And then it will be easy.
I always ask people, what would make this a good visit for you today? Again, it's their agenda, it's not mine.
Do you think a cancer cookbook is in order or would be needed when we talk about nutrition and stuff like that? What could people do at home?
I'm fairly certain that some exist. So yes.
Yeah, good resources along that line. I think Crazy Sexy Cancer, I think has that, is that right, the website?
Yep.
Is it Crazy Sexy Cancer?
She's just a little bit
Okay,
crazy,
all right.
yep.
Other names, Jean Wallace, Jeanne, Wallace, has really good resources. On the website, gregoryplotnikoff.com, I've placed her all-purpose smoothie on there. And this is a nice, the recipe, and then there's different added flavorings. You can create a kind of a tropical variety, and there's a kind of Thanksgiving varieties and Halloween varieties using the different spices for this. But for people who have trouble eating, for people, what can you eat when you can't eat? This smoothie is a good place to start. For people who truly can't eat when they can't eat, then non-MSG broth and bouillons and then working way up to more of a rice-based soup, and then adding little teeny bits of meat and stuff like that, working way back up. But I tell you, I can't believe it's absolute malpractice. I'm going to go out on the edge here. I'm sorry, but going out on this. It's
No, I like it.
malpractice to recommend Ensure or Boost. These things are okay. These things are incredibly inflammatory. And when I hear a physician say a calorie is a calorie, and I've heard world famous endocrinologists say a calorie is a calorie, I have to answer. Yeah, I have to answer that's not right. It's not true. There are foods which are inflammatory, which we do not want. We increase inflammation in the body, and that drives fatigue, depression, progression, weakness, muscle loss, impairs brain functioning. The list goes on and on. We do not want a high inflammatory state. So therefore, we don't want to be taking Ensure with a ratio of omega-6s to omega-3s of 26 to 1. This is criminal. So, excuse me, before I get in trouble.
Wow. Aromatherapy, essential oils, is this the latest fad, or do they have actual benefits? Any research to support any of that?
They have real benefit. I use essential oils during chemotherapy to help myself get through the alcohol wipe and stick of the needle. Simple things like that are unbearable sometimes, and also hospitals are doing it. Why would they do it if there wasn't a reason to back it up?
Again, it goes on to this idea about having control of one's environment. When something is being done to you, you say, what else can I do? What is in my control? Aromatherapy is so easy. You can carry it with you wherever you go. And yes, there is very good research on aromatherapy. It's obviously part of the standard of care in Europe and most hospitals, or at least many hospitals. And there's even a textbook of aromatherapy, which is like about 300 or 400 pages thick. That has full of citations for research. So,
I'll say the Center for Spirituality and Healing at the University of Minnesota does have a course on aromatherapy, and any caregivers who would be interested in looking into that, it's easily found online. I can answer that more specifically afterward if you want.
Go for it.
Okay. I'm a hospice nurse and have been for 32 years, and also a cancer survivor. What I found was really helpful and empowering for me that I tell my patients and tell other caregivers to do this for their loved one. Take that medication, Bob. Take that IV line and either pray with it or send whatever energy you need to do spiritually to help that give the best result with the least amount of side effects. It worked for me. And it empowers them to be able to do something for themselves.
Jen, can you share something? A slide
No.
over here? Okay.
No, just kidding. Yes.
I brought an extra slide or two here. Not that I don't want to go into slides, but I think this idea about intentionality, which you just talked about, is so important. And Ruth, you talked about naming it. So naming it and saying intentionality around it is really good. And we talked about kind of the broken heart and the recurring thing that can get triggered so easily. So I think about this a meditation or a prayer, however you want to interpret it, that has been really powerful about directing our energies out at a time when maybe we focus too much on the in. But whole world. I am living to perform good deeds. I am living to improve myself for the good of all. intention setting out and just kind of saying, okay, yes, I have my pain, I have my suffering. I'm also going to focus outward. And setting an intention like this at the start of the day or at the end of the day has been really powerful for kind of bringing, I guess, calming the spirit. We talk about calming the body, calming the mind. This is calming the spirit to, again, kind of direct us out and in a constructive fashion. And have a certain intentionality that can be very powerful.
Aaron has a question. All of these concepts and ideas, I think, are really powerful, but they're also very adult. Some adults have trouble with mindfulness, I'd say most. So it's a hard thing to do yourself as an adult when you're going through cancer. But what about kids or young adults who are dealing with cancer? How do you help them? How do these alternative therapies apply to them? A 2-year-old can't do yoga.
Can everybody hear? Can you hear what she said? Okay. She asked specifically about children. How can they do these types of things? How can a 2-year-old do yoga or acupuncture or some of these things? Do they translate at all to kids?
Well, yeah, so the question is, what about kids being afraid? Well, you don't talk about being a needle, but you talk about acu-stimulation or something. But kind of a real fun thing is kind of soft belly breathing. Okay, we're all going to get on the floor together as a family, and we'll put your favorite stuffed animal on your stomach, and we're going to breathe, and we're going to watch you go up and down. And so kind of soft belly as you're breathing in, so the belly is nice and soft and fills, and then goes out. There's many fun ways of working this. Kids respond great to hypnotherapy. They don't have all these preconceived, kind of internal critics judging things like that. They respond well to aromatherapy. They respond well to ginger for nausea. They respond, so actually a lot of things really work quite well for kids. Maybe even better than adults, because we become jaded and cynical and the like sometimes about such things, or we've been trained to think that if it's not a pill, it must not work.
There's always a little bit of marketing involved, how you sell, well, that's true for us adults too, but it can have a lot to do with how you sell something to a child, the acupuncture thing, don't focus on the needles. I prefer.
What if they're two?
Yeah,
Yeah.
That's true.
Yeah, exactly.
And
A lot of it's thinking outside the box, the adult box.
Most of the children's hospitals have child life specialists and other staff that specifically know how to translate.
Well, they don't have this type of therapy.
What's that?
They don't have this type of therapy through children. No, we're part of the pain and palliative care program at Children's Hospital. And they do have a child life specialist, and I love her, and she comes and plays. So, and they have a music therapist, which my son didn't respond to, but we've asked about all of these and
Other hospitals. It exists as a profession.
One behavioral pediatrician in town, Tim Colbert, has had many years' experience. I think he graduated from medical school about 30-some years ago. He's been working on this. So there are people, and so they can be consulted by phone regarding approaches. And again, knowing Tim personally, his mission in life is to be helpful, and I think he wouldn't mind, being able to share some insights that could be helpful for if a child's in suffering.
I might like to add as well that I only know what I experience with my own children, but even very little ones like to feel empowered and be able to feel like they're making choices, just like all of the things that we've been talking about for adults. I know my own children worked with my Healing Touch practitioner, even just for a few minutes. Sometimes, do you want to help me make your mom feel better? Or, if you don't feel good, we can do this for you. And for them to know that they could have some control and help themselves or help whoever is struggling was really huge for my young children.
Carol, I worked at the University of Minnesota Hospital as an integrated therapy coordinator, and we brought in healing touch, massage, aromatherapy, acupressure, acupuncture for those children that wanted it, and they responded very well to all of it. Music therapy, guided imagery, they loved, and we have Care Channel on, and they use that all the time. So all of that works really well with children. They're just, some of them just said, they wanted every day healing touch massage or something. So they really respond very, very nicely to it. And it's available.
I'm standing should we do, sometimes I understand not everybody's comfortable like writing down a question and asking in front of the group. So I always think it's best to kind of leave the last 10 minutes or so. If you feel like approaching one of you, are you fine with that? Speaking face to face with humans? Awesome.
We'll get away from the microphones for that.
Yeah, it just is weird. It's just a weird thing. So, yes, hold on.
I just have one quick question for Dr. Plotnikoff. The $99 blood test you were talking about, was there a name for that?
Oh, yes, it's a spit test. Yeah. Okay, and you can order it online at www. and it's 23andme.com. 23 is the digit 2, the digit 3, andme.com. You send them $99, they'll send you a spit kit. The spit kit, literally you spit into and send it back to them, register it, they'll process it. By law, they are not allowed to interpret the data, and that's fine. What you want is the uninterpreted raw genetic data set from it, which then you can upload to a variety of websites. The one I use is www.livewello.com. That's LIVEWELLO.com. And I cannot tell you how profoundly powerful this has been for some people. And one of the reasons I left Alina was I said I should not be the only person doing this in all of Alina, Health Partners, Health East, Park Nicollet, North Memorial, et cetera, et cetera, et cetera. And so my mission is to get more physicians trained, more psychologists trained, more pharmacists trained, more people, more health professionals trained so you can work with an informed health professional on this. In fact, I'm leaving tomorrow for a genomics conference to actually further deepen this capacity. In town right now, there aren't all that many people who are doing it. However, if we look just at the P450s and the CYP enzymes, we talk about detoxification, there are many people who are very talented in this area and very knowledgeable, and you can actually find them relatively easy, or you could develop the skills yourself. It's taught in the dental school, other things. And I can't say enough because there have been so many people who have been, I hate to say, they've felt dismissed, denigrated, discounted, dumped because of the quote, adverse drug reactions or not responding to drugs. And it's because it's their genes. They were born and they could not metabolize the things correctly. It happened to my own sister in her chemotherapy. It's happened to many patients I've seen. That's 20th century medicine. Next generation medicine is at least knowing how our detoxification pathways work. But at the same time, we can learn so much about many other pathways, including ones that can identify what is the ideal diet, ideal dietary supplements, and what things to avoid, including what medications to avoid from this. We can identify what are the metabolic barriers to being able to meditate because the mind is too restless, and the ways we can develop ways to bypass and detour around that. I could go on and on about this. Truly, within 5 years, it will have to be the standard of care because there's going to be too many malpractice cases because the knowledge is readily available. And by far and away, the public knows this, better than the health professions right now. And so, but that should be changing fairly quickly. So, the nice thing about 23andMe is you own the data, not the health system. If you don't want it to go into your chart, it doesn't go into the chart. You own it.
All right. I want to thank everyone on the panel. Thank all of you for coming. Thank you for your questions, for your patience, and just for being rad. Thanks.
Jenna, thank you for being here.